Hi, good evening and welcome to the next in our series of RCGP live panel discussions. My name's Dr. Gary Howsam and I'm Vice Chair for External Affairs at the RCGP and a GP practicing up in Peterborough. For those of you who've not been to one of these events before, please feel free to post your questions on hashtag RCGP Live on social media or below the feed on YouTube that you're watching. We've got members of our team that will make sure we get to see the questions that you're asking. The whole purpose of these events is for us to be able to talk directly to the members about what the college has been doing over the last few months on behalf of you and your patients. So tonight's topic is Brexit. Some people might be wondering why in the middle of a pandemic we're harking back to the last 4 years and the Brexit debate, which I think some of us were glad to see off the 24 news cycle, although not for the reasons that took it away. So the topic in hand, it was back in 2016 that the UK had the referendum on leaving the European Union, and since then successive governments have been working on the deal that will remove us from the Union. On the 30th of December last year, the deal was signed and approved in the House of Commons, and we're now out. For a lot of us in the health community, I think these events have been totally overshadowed by the COVID pandemic, and quite rightly so. The NHS has been focusing on its response to the pandemic, and that may have been a distraction from the discussions that we were having at length around Brexit prior to the outbreak of COVID-19. So where are we at? What does it mean? What are the threats? What are the opportunities? I've got a host of people with me this evening on the panel who will introduce themselves shortly. And really what we need to do is ask the question, why should we be bothered about Brexit? Why are we still worried about Brexit? It's a question we were asking some of our members on Instagram today, and thank you for those who've filled in the poll. That showed that 77% are worried about the future of the NHS after Brexit, and only 23% said they weren't worried. So if I can hand over to our panelists and ask them, as I say, to introduce themselves, please, talk about the organisations they work within, and maybe answer that question. Now we've left the European Union, why is Brexit still relevant to the NHS? And perhaps I can go over to you first, Danny, please.
Good evening, everyone. My name is Danny Mortimer. I'm the Chief Executive of the NHS Confederation, and I have a number of roles that I discharge in relation to Brexit. I chair a coalition of organisations looking at workforce issues called the Cavendish Coalition, and I chair another coalition of organisations looking at broader issues to do with Brexit, called the Brexit Health Alliance, and the Academy of Medical Royal Colleges represents all UK Royal Colleges on that. Clearly the position we find ourselves in now is that we do have a deal in terms of our relationship with the European Union, and that is better than where we found ourselves immediately before Christmas, or where we feared we'd find ourselves. And there are some important things in that, not least the reciprocal healthcare arrangements that are now in place that I know are a real area of concern for patient groups and many clinical teams in the country. But there are significant gaps. Whilst there are agreements around reciprocal arrangements for medical supplies and devices, that doesn't cover every stage of the process. There is only a temporary agreement around data sharing, which expires at the end of June. And the UK response to leaving the European Union is to put in place a whole set of new migration arrangements. And we are particularly concerned about the impact of that immigration policy on our colleagues in social care. They have a far greater reliance on overseas workers than we do in the NHS. And actually, given the relatively high qualified nature of our workforce, we'll find it much easier to recruit people from overseas, whether it's from Europe or elsewhere in the world. So that's a remaining area of concern, I know, for us in the Cavendish Coalition.
Brilliant. Thank you very much, Danny. Perhaps, Victoria, I could ask you the same question. Why is Brexit still relevant to the NHS?
Thank you. Hi, everybody. I'm Victoria Giorgio Brown. I'm an academic GP in East London and also the RCGP's Joint Honorary Secretary. And like many European doctors, I did part of my training in the UK, and I have been following with interest the Brexit developments. So is Brexit still relevant for the NHS? The UK became a member of the European community before I was born, so a very long time ago. And therefore there will be, I think, many interdependencies that will need to be completely disentangled, and this will take time. and also presents challenges. In terms of the impact of these on the NHS, I think the main areas that can be affected will include medicines and medical devices and other consumables, data exchange, and of course, workforce and research.
Great, thank you, Victoria. Perhaps I can go to you next, Louise.
Hello, everybody. My name is Louise Sands. I'm a portfolio GP, was a partner for 20 years in Lisburn, Northern Ireland, and now I continue doing my sessional work there. I'm involved as the educational lead for the induction and refresher scheme in Northern Ireland, which primary goal is encouraging doctors to return to the profession or to bring doctors from the EU and beyond to work in this lovely part of the UK. And I'm also involved in GP specialty training in NIMTA and Queen's University, our current sole medical school in training medical students, with the view that there's another medical school coming on online. So for us in Northern Ireland, we have the unique position of being directly connected with a land border, and now with this infamous Irish sea border. So the challenges potentially have been probably unique, and it's still very uncertain, but we do have many doctors that work potentially on either side of the border, and patients that travel as well. So very, very keen to ensure that we have the workforce that we need in this part of the island, and that we don't get lost in the bigger picture.
Brilliant, thank you very much, Louise. And over to Camilla, please.
Thank you, and good evening, everyone. My name is Camilla Hawthorne. I'm a GP in Mountain Ash in the South Wales Valleys, and I'm also an academic GP, head of the Graduate Entry Medicine programme at Swansea University. Speaking as a GP, I think Brexit is still very relevant to us, although we have a deal, which is much better than a no-deal situation. The devil is still going to be in the detail, and we will have to see how the medicine supply chain actually works, how medical medicines regulations and licensing will work, with the MHRA now taking over from the European Medicines Agency. We're also worried about staff and workforce. This is a recurring theme so far this evening. I'm particularly worried about staff in my local care homes, many of whom are from Europe. I'm also worried on behalf of some of my patients who seem to spend quite a lot of their winters in Spain and Portugal, and how their healthcare will be impacted upon, in spite of the fact that there does seem to be a reciprocal arrangement being set up. As an academic, in terms of students, our EU students will now be classed as international students. The Erasmus scheme is no longer going to be open to Britain, as it has been in the past, and instead a new scheme's coming in. And I'm worried about research and opportunities to continue the really vital collaboration that our medical researchers have with European colleagues overseas.
Excellent, thank you, Camilla. Thank you for joining us, and thank you for highlighting some of the issues. And over to Dave, please.
Hi, good evening, everyone. My name is David Knowles. I'm the Head of Campaigns and Public Affairs at the Royal College of GPs. And for those who don't know, the RCGP is the member organisation for GPs in the UK, representing over 52,000 members. Why do we care about Brexit? It seems a long time ago now, but it wasn't that long ago that Brexit was the big public policy issue affecting the NHS. It was what we're all worried about. And obviously it's been replaced somewhat by coronavirus. And I think that one of the big things for us is workforce. Clearly, a lot of doctors, a lot of GPs, people across the NHS will be considering their professional futures as a consequence of coronavirus. It's clearly had a huge impact on the well-being and welfare of staff. And when we have a lack of ability to take doctors from other parts of the European Union, there are clearly going to be implications further down the line for what our workforce looks like in a couple of years. One of the things we're never very good at in the NHS is looking to the long term. We're very short-termist. We always do things by week, by month, and I think that Brexit could be something that trips us up further down the road unless we address all of the issues mentioned by the panelists who preceded me this evening.
Okay, thank you, David, for that introduction as well. So just listening to you on the panel, I've written down a whole long list already. So we've got workforce issues, workload issues, access to care and to medicines, regulation, research, bureaucracy, social care workforce, and general uncertainty. So a whole host of topics that we'll be able to pick up during the course of the discussions. Dave, I want to come to you with a question about the position council took around Brexit, because that was quite an unusual move, some would argue, for a body like the RCGP, which is apolitical, to take a stance on something that obviously at the time was a political or very divisive political topic of debate. So perhaps you could just explain why the college took a position and why it was appropriate for the RCGP to do so.
Yeah, absolutely, Gary. As I said in the answer to the previous question, I mean, Brexit really was the big public policy issue of our time only 2 or 3 years ago. And although it was a very political issue, it wasn't exclusively a party political issue. I mean, you have people in the Conservative Party who wanted to remain. If you remember, David Cameron actually resigned as Prime Minister because he perceived himself to have lost the referendum because he campaigned to remain. We have people on the Labour side who wanted to leave. So I don't believe it was a party political issue. However, it was the biggest issue that affects the NHS, and it was the biggest issue facing government at the time. As a public policy team, one of the frustrations we had was that legislation was tabled for many years as a consequence of Brexit. And we had a government that essentially did nothing else for about 18 months, 2 years. One of the reasons the college decided to take a position was that if we hadn't have been taking a position on Brexit, that would have impacted on our relevance to our senior stakeholders. That would have meant that we wouldn't necessarily have been part of the debate or around the table with government when we had to. One thing we certainly recognise is the wide range of opinion amongst the membership. It's inevitable that if you represent 52,000 people, you'll probably have 52,001 views. And, you know, I know our council are very, spent hours deliberating that, frankly. And of course, in the end, we decided that we thought that Brexit was of huge risk to the NHS. Ultimately, you know, we are a charity, but our aim is all about patient care. It's about ensuring that we have high quality patient care. And I think that if you look at the council motion, one of the things people felt was that high quality patient care was on the table when we were talking about Brexit. And we did have big problems and big fears about the future as a consequence. So that's why the college decided to take a position, and ultimately why our council debated it and came to the decision they did.
Okay, thank you for that, David. And I think it's really important that we show to the membership that one of the roles of the college is to make sure the voice of the membership is heard amongst those senior policymakers. And I think this is a prime example where the wisdom of council to portray those views up the line was done very successfully. I'd like to come back to you, Danny. You mentioned that you're chair of the Cavendish coalition. Can you explain a little bit more about what that coalition is and the things that you're still worried about, despite the fact we've now got a deal? You did touch on it in your introduction, but maybe...
Yeah, no, of course. No, thank you. And thank you again for having me along. One of the experiences we had prior to the referendum result, the vote to leave the European Union, was that the NHS in particular was very reliant on staff, particularly nursing staff from overseas, and was struggling to get those people into the country. And the government didn't officially designate nursing as a profession in shortage until 2015. And one of the reasons it didn't do that was that the sector as a whole struggled to speak with one voice and give one consistent message about where we found ourselves. So when we had the referendum, and we led a very successful campaign with colleagues across health and social care to get nurses placed on the official shortage occupation list. And when we had the referendum result and the outcome, we knew we'd become increasingly dependent as a service and set of services on colleagues from the European Economic Area and elsewhere in the world. And we brought together a set of organisations, and over the 4.5 years we've been working together, we've now got 36 members of the coalition. We're very consciously a UK-wide organisation. We represent health and social care, statutory and non-statutory organisations, and employer and trade union voices as well. And I share the chairing arrangements of the coalition with the head of health for Unison, the largest trade union in health and social care, and also the executive chair of one of the big social care representative forums. And the intent of the coalition was to do three things, really. The first was to make sure that as a country we gave certainty to our colleagues from the EU. 6% of the NHS workforce, slightly more, of the social care workforce are EU nationals. The second was to make sure that whatever migration system we had after leaving the European Union was fit for purpose. We don't yet believe we're there with that. In particular, as I've said, it's much harder for social care colleagues who are arguably more dependent on non-UK nationals than the NHS to bring colleagues in. And the third is to make sure that both we as organisations, but also the government, did much more to stimulate domestic supply of workers. And again, that is still something of a work in progress for the government in particular. And again, particularly in relation to the long-standing problems now in social care. It has been really important, and I think it remains important for us to try and speak with one voice, to have a consistent set of messages, and to form one place where the government can come and engage with the sector about workforce issues. I think that has led to a greater understanding of particularly the problems in social care. There is real power in the Academy of Medical Royal Colleges, for example, articulating very consistently its concerns, as Camilla outlined, about the impact of Brexit on our colleagues in social care. And similarly, it's very helpful for our colleagues in social care to reinforce some of the things that have particularly concerned the NHS. So that's the coalition, and the work still continues, even though we've left Brexit, not least because there's much more to do in relation to domestic supply, and there is clearly much more to do in terms of our immigration policy as well.
Brilliant. Thank you very much, Danny, for that comprehensive answer. And as you say, a work in progress still. What I'd like to focus on now, I know that three members of the panelist frontline GPs, and obviously one area that we're very concerned about is the impact that this will be having on our patients. So perhaps I could come to Camilla first. You touched on this in your introduction about how your patients are reacting to this. Are they worried about access to care or medicines, or are they ambivalent?
They were worried a few months ago. I think COVID has created its own mind fog and has superseded those worries. And so my patients are not really talking about Brexit at the moment. However, I'm sure that once COVID recedes, it will come back because, of course, people do go abroad far more than I thought they did. But the winter months are definitely times for emigration from the South Wales valleys. And also, we all know as working GPs, those of us that are, how rapidly medicines just suddenly become unavailable. 10 years ago, it just didn't seem to happen. It was almost unheard of for something to be unavailable, but that's happening all the time now. And so, of course, one realizes what a fragile system it is, not as robust as we think, and how easy it would be to upset it.
Okay, thank you, Camilla. I'm going to come to you next, Victoria, because you work a long way from the South Wales valleys in the part of London that you do your frontline general practice in. What concerns do your patient demographic have around Brexit and the changes that we're seeing?
Very similar to Camilla's, actually, despite the distance. There haven't been any recent concerns that patients have expressed, and I believe this is partly because COVID has dominated the conversations. However, also the Brexit negotiations have been quite protracted, and the risks so far have been very hypothetical. So I think patients are more likely to react and raise concerns if there are problems in the future of actually obtaining their medicines. And this will present, as I said, in the future rather than now.
I guess one of the things we need to be careful of is that we don't put down all supply issues to the fact that we've gone through the Brexit process, because it's obviously a lot more complicated than that. So that's something perhaps we've got to look out for in the future as we go down the line as well. Louise, if I can come over to you, and you say you're working over in Northern Ireland, any different sorts of anxieties your patients have either about medicine supplies or about any other aspects of the Brexit process?
Well, I think naturally enough, because we're separated by that area of water, there were very real concerns regarding the medicine supply issue. That hasn't been apparent, thankfully, to date, and we're very consciously watching that. But again, the distraction of the massive impact of COVID and other things in fact affecting medicine supply chains and shortages and things right now. I work fairly central to Belfast, but I actually took the chance to speak to a couple of colleagues today who do work in border areas, and that brings up a whole different set of issues where staff in the GP practices perhaps live on the other side of the border, as well as the fact of patients who would be travelling back and forth to perhaps access care in Northern Ireland. And to date, they have actually felt reassured, again, in the midst of much other greater priorities, but the patients so far having been anxious, feeling more comfortable. I should also add that Northern Ireland is in the unique position that we have had the promise that our EHIC card is going to become a GHIC card, and so they have guaranteed that the citizens of Northern Ireland will continue to have that benefit, and I think that's probably a very small sweetener, but it's probably gone quite a long way, bearing in mind what some others are saying about that sense of travelling to other parts of the EU and the impact of that.
Okay, thank you. So it's really important that we hear and we understand the anxieties of our patients. And I think what I'm hearing from the comments so far is that at the moment, perhaps some of those have been unfounded, but there's still a lot of uncertainty out there. And further down the line, we need to be very mindful of potential problems coming along the way. Talking of potential problems, I think one of the things the college has been highlighting for a long time now is the issues around workforce. And I'm hearing very strongly already from this discussion that workforce issues are a massive concern, not only for the college, but for the members of the panel that are here as well. In England, we've been arguing for a long time and we've been promised successfully another 6,000 GPs, but we need them right now. But we also need to be able to ensure the pipeline further down the line. So that means recruiting into medical schools, training people and then retaining them, and also keeping hold of the doctors that we've got from overseas already. So I know, Camilla, you're involved in universities in your part of the world. So perhaps you could tell us a little bit more about any anxieties you have with your university and academic hat on around what we've seen so far and what we could potentially see in the future, please.
I think for the current medical school places that we've got, I don't feel too worried about not being able to fill them. There are already 8 people applying for every one place, sometimes more than that. So what we really need to think about, though, is how we increase that those numbers of places, because we know that we're short of medical professionals. We know that it takes a good 10 to 20 years really to grow a consultant or a GP. And we need to really start planning that now. In fact, we probably should have started it some time ago. The Royal College of Physicians has just produced a report that they've called Double or Quits, in which they're suggesting that we double the number of medical school places from 7,500 to 15,000. Of course, the costs would be just eye-wateringly large. So all of these things need to be taken into account. It's good to see new medical schools coming on board, as they are in Kent and in Ulster very shortly, I think, and Strathclyde, I think, and many other places. So it's really good to see them, but they're nowhere near going to be enough people. And we need to think really hard about how we recruit doctors from overseas, particularly from countries that need their own doctors, probably rather more than we do. So, we need to think about the ethics of that as well.
And that last point is one I'd like to pick up later on in the discussion, if I may, Camilla. You've talked about the new medical schools in Ulster, so I'll bring Louise in at this point and maybe sow the seed of a question, which is, you've said, Camilla, that the cost is going to be very high financially, but I just wonder whether we can afford not to invest in a workforce that's more homegrown. So over to you, Louise, please.
Yes, so yes, delighted to say that, first of all, Queen's Medical School started its new curriculum, C25, launched in the midst of the pandemic, so not quite in the way we anticipated, in autumn of 2020. And that's very exciting because almost a quarter of time is going to be spent in primary care. So it's a real shift for the medical school to deliver, and it's been fantastic to be a part of that. And that's happening alongside the Ulster University Medical School coming on stream after so much patience and political wranglings to have the finance to have that graduate entry medical school. And again, its focuses on primary care delivery of a lot of the training in a 4-year programme. So we again are oversubscribed as a medical school, but we very much want to encourage both those within our community, and the college locally has done a lot of work within schools and sixth forms to make access to medical school more accessible. Delighted that our own GP society in medical school, with the help of the college, has really done a lot of sort of initiatives to try and bring that profile up and encourage those that maybe haven't thought about it. And particularly, we have many more medical students from overseas to consider a GP career locally here. So I think it's exciting, but also daunting to be able to know how we're going to deliver that. Not least because in the example of COVID right now for doctors or for medical students and training and being on placements in practice, the challenge of where they're based and supporting them during their medical school training. So alongside having those doctors here in training, and the same with GP specialty training, is an opportunity. And we would love to see more doctors coming across from the EU and to be able to broaden that.
Okay, thank you. And that reminds me, I want to take the opportunity just on that point you've made about the trainees and the challenges they faced through COVID. A big shout out to them, because I think as a part of our GP community that have faced a number of challenges around their assessments, around redeployment to different roles and disruption in their training. I think they've shown the sort of characteristics that reassure me that the profession is going to be safe in their hands. The college has done a lot of work with the Observe GP platform for work experience for aspiring medical students, and as you say, with the Discover GP programs and with the medical school. So college plays a very active role in terms of trying to encourage people into our speciality. But David, I was just wondering, from a sort of policy point of view, or from your side on the policy team, is there anything else you can add to this question?
Yeah, and I think it links in nicely with what you just said, Gary. Actually, one of the things that I think we won't know the answer to for some time is about the perception of medicine as a career choice following Brexit. And one of the beauties of medicine, I suppose, maybe 10, 15 years ago, was the idea that you could go abroad and practice in Europe, in other places. You could see the world and your qualifications would be recognised in a relatively straightforward way. Obviously, the EU and our exit from the EU, that's now changed. And as a consequence, I wonder if that will then change medical students deciding to go down the route of doing medicine as a degree. It's not something we'll be able to answer for another 5 or 10 years. But I think one of the negatives of Brexit, and I suppose one of the tragedies of Brexit, is it does alter the perception amongst young people of what's possible. And that was a real advantage. Medicine had a real advantage in that sense. Prior to our exit from the European Union. So as Camilla says, and as Louise says, one thing that's crucial now more than ever is ensuring that we fill those medical school places as best we can, looking at reports like the RCGP and making sure that we increase medical school places if we're going to have an NHS that's fit for the future.
Okay,
Gary, can I just can I interject just slightly there, just to say this year, now this may be a one-off, but very much to everybody's surprise, the numbers of applications have gone up about 14% overall across the UK. It's interesting, isn't it? I don't know if it'll be sustained.
It'd be a nice thought, though, wouldn't it, if we could sustain that increased level of interest. Danny, I think you wanted to come in on that point as well.
It's a couple of things. The first is to say, I mean, obviously, we have seen in all healthcare professions and courses some greater or lesser increase in applications. I guess we all presume because of the pandemic. And the government have committed to support those extra places, which is very welcome. I think there's an interesting challenge for all of us, for medical rural colleges, for those of us that employ many of your members or work with your members as independent contractors, about where the government invests in workforce and where it chooses to do that. We have seen investment in medical school expansion by this government, by Mr. Hancock's predecessor. We've not seen the same level of investment in expansion in other professions. We've seen numbers of doctors practicing in the UK grow by 10% in the last 5 years. We've seen numbers of nurses practicing in the UK grow by 3% in the last 5 years. We have particular challenges in mental health and learning disability services. We also have geographical imbalances in the way in which particularly medical training and medical employment is distributed. You know, there is a very apparent bias in England towards London and the South East, and the country kind of tips slightly in terms of concentration of doctors per head of population, both in training and employment terms. So there are a whole series of questions to have there about where priorities are set. And I appreciate as a medical Royal College, you know, you have a responsibility to your members and to continue to grow your part of the medical profession. But we have failed as a country to properly invest in every aspect of our workforce over the last 20 years, and we've particularly failed to invest in the non-medical professions. And I think there's just an interesting conversation there that I know the Royal Colleges are part of. We've had some very productive exchanges about that. I think the Royal College of Physicians report is disappointing, actually, because it doesn't speak to the team as a whole. There are fewer nurses per doctor now than there were 10 years ago. There were 3 nurses per doctor in this country. 10 years ago, there were about 2.6 nurses per doctor now. And my experience, 30 years or more of working in healthcare, is that it's a team sport. And actually, we need to try and have equitable investment in all areas of the team. We are very reliant and have become very reliant in the last 10 years on international colleagues joining us. That's particularly international medical graduates in medicine in greater proportions than EU doctors now. And we've also become very reliant on nurses in particular from outside the EA. And that did accelerate following the referendum result, both because of the referendum result, but also changes in language testing that the regulator for nurses introduced as it happened the month before the referendum. And that has changed our kind of recruitment patterns. And the government has a very, very long road indeed to travel to make us less reliant on those international colleagues.
Excellent, thank you, Danny. I want to ask Victoria a question. We've talked about recruitment and the pipeline, but one of the things that I was just thinking about as we were going through those last series of answers was the impact that COVID's going to have on retention, but also the impact that Brexit rules might have for retention of a current workforce. I don't know if you've got anything to say on that, please.
Yes, retention is an issue that needs attention going forward in view of Brexit. A 2018 BMA survey of 1,500 European doctors showed that 35% of these, so over a third, were thinking of moving abroad following Brexit. And the main reasons that were stated there were, first of all, the decision of UK to leave the EU. The second reason was the negative attitudes towards EU workers. And the third reason was the uncertainty about personal immigration status. And interestingly, 37% of those EU doctors were not aware of the government's settled status scheme for EU nationals. So one can ask, okay, is this really a problem? And does the NHS heavily rely on this workforce? And the answer to this is, it is important because EU doctors make a significant percentage of the current workforce. We don't have very accurate figures, but they do. And the fact that we don't have very accurate figures, I think, is something that we really need to address quite quickly. Interestingly, there are 2 sources of data on this. The first source of data is the NHS Digital, which collects data on nationality of NHS staff. However, this is not necessarily regularly updated, and also it doesn't capture any changes to nationality or any dual nationality that many people have. Another source of data is the GMC data, which records the country of primary qualification of these doctors. But again, this is not very accurate because British citizens may qualify abroad and EU citizens may qualify in the UK. So there may be some overlap there. However, you can easily access, with these caveats, you can easily access the GMC data online. And according to this, currently there are 4,500 doctors on the GP register, and this roughly makes about 6% of the GP workforce. 17,500 doctors on the specialist register, and this makes 17% of our specialist doctors. 4,400 surgeons, and this makes 23% of our surgeons, and 2,800 doctors in training, which makes roughly 4.3% of our trainees. So it is a considerable part of our workforce. The question then is, okay, now Brexit has happened. The survey was in 2018. Have these predictions of all these exodus of doctors materialized? And there was a BMJ article published in November 2020 on this, which actually showed that this exodus has not materialized yet. In fact, the number of EU doctors has slightly increased, while the number of nurses has slightly decreased. But it may be too early to say, and that's where we need to put, I think, in place certain conditions and certain make sure that certain changes do take place in order to avoid this exodus from happening and in order to retain those people in the profession. And I think probably if I had to pick 4 factors that would influence these decisions, the first one would be the bureaucracy in terms of the points-based immigration system. So how easy is it for people from the European Union coming here to work as doctors and nurses? The potential changes in the working conditions, which may happen. For example, think of the junior doctor's contract. So how easy these conditions will be, how attractive these conditions will be, so that people can come and work in the UK. The opportunities for research, and also, and probably most importantly, how welcomed these people will feel in the UK.
Thank you, Victoria. And you've highlighted at the end there some real challenges and things that we should be focusing on. David, I wonder if you wanted to come in from a sort of a policy point of view. What can the college do to make sure those challenges are heard by the power brokers and the power holders in the system, to make sure that we don't run into problems that we can see further down the line?
Yeah, thanks, Gary. I think all those issues Victoria highlights are relevant for GPs who are practicing now, who are looking to practice in the future, and part of the wider NHS and wider practice team as well. As Danny says, it's important that the whole system works together. I think one of the things it's about that we need to be doing and continuing to do is about ensuring that we're putting the message across to stakeholders, putting the message across to government about the role general practice has played throughout the coronavirus pandemic. Primary care has really stepped up to the plate if you look over the last couple of months, particularly with the vaccination programme. And I think we've really shown just how important primary care is to the wider NHS. So making that argument will be more important than ever as we get to a post-pandemic world. I think one of the other things to remember as well is that our issues pre-pandemic have not gone away. You know, we still need the workforce numbers. We still need to make general practice a more attractive place to work. And that means reducing red tape. That means reducing needless bureaucracy. That means improving technology and improving systems and improving GP premises too. All of those issues are not solved as a consequence of coronavirus ending. And there'll be something that we continue to lobby on and continue to speak to government about for the foreseeable future, I imagine. And the dual problems of Brexit and a post-pandemic environment mean that those issues are more important than ever.
Okay, and in theory, Dave, that's easy to say that we should be talking to government and things, but what does that mean in practical terms? Because, you know, the college is in quite an influential position and has access and lots of meetings with ministers and things. Can you just tell the audience a little bit about how that actually works on the ground?
Yeah, of course. I mean, I'll give you an example now, actually, and a bit of a plug for a recent piece of work we're doing. We're currently surveying members. We've got a survey out in field about coronavirus vaccines, making sure that we're aware of where the problems are in different parts of the country. The way we typically influence is to use our members' voice to get to government, get to the door and say, look, this is what we're being told. In order for us to do that most effectively, practical examples of what's happening on the ground works best for us. I mean, over the course of this debate, we've talked about surveys from other organisations, and that's something that we do ourselves. So it's very much using the members' voice, using forums like this, where we're taking people's concerns and relaying them to the very top levels of government, and making the case and making the argument about why GP is an important proponent of the NHS and why we need further funding going forward and in the future.
Excellent, thank you. We've had a couple of questions through from foreign-born providers to practice in the UK, and another one on a similar ilk of what do you propose should be done to maintain the influx of doctors from overseas. I'd like to take one small element of that and ask you, Louise, perhaps if you've got any comments about how we can ensure we've got the flow from the Republic of Ireland, which I guess is something that in Northern Ireland is something you're thinking about.
Yes, thank you. It's an area that's of huge interest to all of the UK, but particularly for obvious reasons in Northern Ireland. So the sister college based in the south obviously has a 4-year GP specialty training programme, which we're quite jealous of, obviously in part. And at this point in time and historically, those GP, when they CCT, are managed in the UK in the same way as a doctor that is coming from any other EU country based on legislation. So they have to do the entry into the induction and refresher scheme, despite having just completed their membership exam, which to all of us seems a little bit unusual and part of the obviously the system and the effects of an EU open system. So it is an area that these doctors, obviously, as we all know, are working in a very similar culture in terms of what they see in the socio-demographics of healthcare. So many things are similar in an equivalent level of training. And so it's a fantastic opportunity, particularly because a number of those doctors have been born and bred in the north and perhaps have gone to medical school and GP training in the south. Many obviously do come to the rest of the UK, but at the moment there have been many barriers to make that difficult. The college has been hugely proactive in creating these streamlined processes for other parts of the world outside the EU, so particularly for Australia, New Zealand, South Africa and Canada, and the opportunity to consider post-Brexit that the Republic of Ireland could be perhaps viewed and looked upon as a country where they have a very similar training programme, and that those doctors perhaps could enter the GP workforce differently. So I think there are opportunities that might come with Brexit. It's a very complicated, and I don't begin to understand the policy and the legal framework around that. But it's a workforce that is of huge skill and value, and many want to work in more than one area.
Brilliant, thank you, Louise. And I'm just being told by the technical team that that was an answer to a question that some people may not have heard, because I think I was breaking up a little bit when I asked the last question. So apologies for the poor broadband where I'm sitting in my cupboard under the stairs at the moment. But thank you for a comprehensive answer, and we'll get the technical team to put some captions on just so we capture that question when people are watching back later. I just wanted to pick up around, and I'll probably go to you, Camilla, on this one, around the new immigration and visa systems, whether that's had any impact on the medical school yet. I'm guessing it might be a little bit too soon yet, but I just wondered if that's something the universities are planning for and cognizant of.
I think it's been a real worry for universities. I know the Russell Group were particularly talking about this not that long ago. It's interesting how the detail is coming out now bit by bit. So we know, for example, that people from the EU who are already resident in the UK can apply for the EU settlement scheme. And we know that people who are coming in with jobs in the NHS have a fast track route called the Health and Care Worker Visa, and are exempt from the immigration health surcharge. It's all detail, isn't it? And people are going to have to navigate these new systems, but it is still early days.
Okay, thank you. I just want to pick up on a point, Danny, that I think you touched on earlier on, and we know in general practice, as much as any other speciality, that it is a team sport. But what I think we've had highlighted through the pandemic is the real importance of social care workers. And you've talked about the impact on the social care workforce. I was just wondering if you could share any more thoughts you have about that particular element of the workforce and what we should be doing and looking out for in terms of that, because we know the level of support they provide to us in general practice is phenomenal.
Yeah, and vice versa, I know, and from talking to social care colleagues. I mean, the most challenging aspect of this, of course, is that whilst we have had investment in the NHS in recent years and in NHS-funded services, I think we're all very clear that that hasn't kept pace with the demand that your members will be seeing in their communities and practices. We still need investment in public health, we still need investment in capital, we still need investment in education. A lot will also need to be done as a consequence of the impact of the pandemic on all sorts of services. Social care has seen disinvestment over the last 10 years, so that's a particularly challenging context for our social care colleagues. What we see in social care, which obviously has a largely non-registered workforce, a kind of care assistant-based model of delivering care both in people's own homes and in residential settings, is a much greater reliance on non-EU nationals and EU nationals than we would see in the NHS in those type of roles, care assistant roles. That does appear to be a function of the job market that they find themselves in. Care homes and domiciliary providers don't pay as much as the NHS would pay a care assistant type role. They pay significantly less than we do, particularly since our large pay deal 3 years ago. And whilst the economy will look very differently as we emerge from the pandemic, our social care colleagues don't believe that they'll necessarily be the kind of large-scale response to filling vacancies in social care. And they do want to make sure that they can continue to access and recruit colleagues from outside the UK if they need to. In some ways, the biggest area of concern is that the government have designed a system which doesn't allow them the flexibility to respond to that situation. So if it is that we don't see increased domestic employment in social care, particularly if there's a significant lag in the investment we all want to see in social care, then actually it's quite a laborious process then, as we've experienced a number of times in the NHS in recent years, to change the immigration system and make it that wee bit more flexible. In simple terms, we'd like there to be points available for work of public value, and particularly the kind of roles that I've touched on in social care settings. So that remains a priority for us in our work as a coalition, and something that we'll continue to make the case for. Albeit Camilla is right. I mean, we're 2.5 weeks into a new immigration system, so in the middle of a global pandemic. So it's a little early to predict how it's going to play out, but we do think greater flexibility is needed. In more general terms, I think Camilla made a really important point that we also want to make sure that the system that we have for whatever part of our workforce is as easy to use as possible, and that it is as affordable as possible. And the government have made some changes in this last year to remove some of the additional charges that overseas workers in the health service had to pay. But as anyone who's ever recruited a colleague from outside the EU prior to January will be able to attest, it's a very complicated system that we ask people to go through. We do want that to be as streamlined as possible. And of course, there are particular challenges as well, and there are some additional hurdles for general practice in terms of the list system, which is in excess of the migration system and the things that the GMC might require. So I think there will be a case over the next year or two for all of us to look at our processes, both the government and the regulators and the national bodies as well, just to make sure that the processes are as streamlined as possible. I know the GMC, for example, believes that with reform of its legislation or its legislative framework, it will be able to kind of streamline and make much more sense of the process that it has to run for international medical graduates and for them to join its registers.
Okay, thanks, Danny. We're running short of time, as we always do in these discussions, so I just want to move the debate on a little bit. one of the areas of responsibility that I have as part of my portfolio is the Research Surveillance Centre and the RCGP. And we've seen a huge expansion in primary care research during the course of the pandemic. Now, I wonder, Camilla, can I just come to you and ask you the question about what the impact of Brexit might be on universities, and particularly from a research sort of angle with your academic background, please?
Yes, of course. Most research nowadays involves multi-centre collaboration, much of which is international, not just with the European Union, but the European Union are our closest geographical collaborators. And if that were to be interrupted or made more bureaucratic or more difficult, then that could have quite a major impact on our ability to produce cutting-edge medical innovations from the UK. So previously, this has been very easy to do. Apparently, the new trade deal is accompanied by a joint declaration on participation in union programs. And there are a number of programs that UK researchers are very involved with. My understanding is that the UK government is making a financial contribution to the EU budget in exchange for ongoing involvement in these programs. But, you know, again, we will really have to wait and see what happens. Now, it may well open up opportunities to collaborate with other countries who are also doing fantastic research across the world. So it isn't necessarily going to be a barrier, it might be an opportunity as well. But what we don't want to do is throw out the baby with the bathwater.
Okay, thanks, Camilla. And Victoria, if I can ask you the same question again in the context of, I mean, the COVID vaccination programme and developing the vaccines saw a huge effort to collaborate across international borders. And for an eternal optimist like me, that could be a good omen of things to come in the research arena. What's your take on that?
Yes, you're right, Gary. Research requires collaboration, as also Camilla has mentioned. And there have been some positive steps here. So the EU-UK Trade and Cooperation Agreement has cleared the way towards the UK accessing the Horizon Europe, which is a EU research programme. And although the terms of this agreement and the details have not been finalized yet, the agreement itself confirms, I think, to me and to researchers, the political will on both sides to actually continue a close scientific cooperation. And I think this is a very positive step, which will hopefully help to lift the uncertainty that has been there over the last 3.5 years within the research community, and which seems to have had, from the data that I have seen, some negative impact so far. So I think over the last 3.5 years, there has been a little bit of hesitancy in terms of the UK researchers and applicants to take on the coordination of EU projects, because obviously they didn't want to go into the risk of losing potential EU funding in the future, commit to it and then losing it. Also, European research consortia seemed to be more reluctant to take on UK partners in their research projects because that could have reduced their chances to get funded. And I think also researchers themselves, because of the immigration status uncertainty and the career perspectives, they may have been more reluctant to actually move to the UK. So they saw UK as a less attractive option as a research destination, especially for doctoral and postdoc students. So I think in the coming years, hopefully we will have to, the agreement with the Horizon, to access the Horizon Europe program will help us to kind of reduce this uncertainty going forward. Of course, this will depend on how the British government addresses the remaining changes that need to happen that affect this research collaboration. Also, the mutual recognition of professional qualifications amongst researchers, because this has not been addressed yet. And also any mobility issues of researchers to and from the UK.
Okay, thanks for that, Victoria. And talking about sort of international collaboration across borders, Louise, can I just come to you very quickly around the Erasmus programme and any impact that these changes may have had in Northern Ireland around that?
So just to say, really, we've been very fortunate. So there's lots of bad news stories out of Northern Ireland, but one of the other good news stories we've had clarification on is that we will continue in Northern Ireland for universities to have the opportunity to be involved in Erasmus, I gather funded by the Irish government, and obviously whilst the UK government is looking at other things, we've been assured that any student in higher level education will have that same opportunity.
Okay, thanks, Louise. I'm going to move us on to the question around supply now. There's questions around supply of medication, and I think we're probably on slightly dangerous territory putting all supply issues down to Brexit. But I was wondering, Danny, if I can come to you quickly, has the government done enough to guarantee the future medical device supply routes, do you think?
I was at a meeting last week with industry and the minister, the UK government minister, Lord Bethell, and they were pretty pleased with the progress, the agreement that's been made. There are some challenges. The agreement isn't a totally universal one in terms of mutual recognition. So in terms of the current interest that we all have in vaccine supply, there isn't mutual recognition of batch testing, for example, between the UK and European regulators. But again, compared to where we expected or we feared we'd be in the tail end of last year, some significant progress has been made and there is mutual recognition. It doesn't directly impact upon the vaccine issues that general practitioner colleagues on the call will be facing at the moment. You know, there are issues around supply and procurement of the COVID vaccine, which aren't related to Brexit, good or bad. I would observe.
Okay, thank you very much. And Dave, do you want to come in from a sort of legislation point of view on that question at all?
Yeah, just briefly to say that, you know, it's hopeful that the government don't need to legislate for any of this stuff, and that supply chains will be in place, and the proof will be in the pudding, I suppose. But, you know, we're seeing with the COVID vaccination, although that's a separate issue, it does show you that there's a lot of things you can't plan, a lot of unknowns, I suppose, which might affect us further down the line. So it remains to be seen. But at the moment, as we say, we do have a deal. So it's a bit more light than it would have been if we didn't have one.
Okay, thanks very much. We're going to have to start wrapping up soon, but one of the poll results I just wanted to highlight was we asked our members out there today on Instagram about the level of information that they feel they're getting from NHS England and the government around the implications of Brexit. And 3% were saying that yes, they're getting enough information, and 97% were saying no, they weren't. And we all know how dangerous an information vacuum can be, because it often leads to uncertainty and anxiety. So maybe there's a direct challenge for the policymakers there to improve the flow of information. As we come to the end of the discussion tonight, a big thank you to all of you, but I'd just like to give you 30 seconds, really. We've talked about some of the silver linings of Brexit and some of the dark clouds of Brexit, but maybe your personal viewpoint in 30 seconds of just one thing you'd like to wrap up, one thing you're taking away as either a really good news story or something that you're particularly worried about. And if I could start with Louise, please, on that one.
Thank you, and thanks for allowing me to be involved this evening. I think for me, the downsides I think are still the uncertainty of what's happening, what we don't know yet about supply chains, and particularly where we are in Northern Ireland. It's too early to know when too much is happening around us about COVID. But there's for me, how huge the silver lining is, we've got much more certainty than we did in the last couple of years. And for that, we can now plan and look at recruitment and look at opportunities to bring doctors in. And particularly for me, it's a good news story in Northern Ireland. Whilst we've got this complex arrangement, there are really, really good opportunities of what's allowed us to do. So, yeah.
Brilliant. Thank you very much. And then on to Camilla, please.
So I think wearing my academic hat, I see great opportunities for widening international links with other countries academically and in research. From my GP hat point of view, however, it's really rather more on the dark cloud side, because I still worry about medicine supplies and I worry about staffing, particularly in our care homes. And that is something I will bring in COVID, because COVID has really shown us how much we need to be putting into our social care in this country.
Thank you. Danny.
I think it's that simple message that I think we've all touched on, that there is still significant work to do between the UK government and the EU. There is still some areas of the agreement that are temporary or aren't in place at all. And we need to make sure collectively as a sector that actually that agreement does take account of the particular needs that our patients and services have. And that's a role we've fulfilled with your help in recent years, but there's still a year or two's work to do, I think.
Okay, thank you, Danny. And over to Victoria.
So COVID has highlighted our interdependence and how important it is that we work together. So moving forward, we need to address any insecurities, smooth out any remaining uncertainties, reinforce the need for inclusivity and celebrate our wonderfully diverse health and social care workforce, and develop strong collaboration and cooperation with our European neighbours.
Thank you, Victoria. And finally, over to Dave.
Yeah, I suppose the good news is that we don't have a no-deal Brexit. The college was clear throughout that would have been the worst possible scenario for the NHS. We warned about it in our general election manifesto of 2019, and luckily we do now have a deal. But I think the negativity is that, as everybody's really said, there are still unanswered questions. The health service is going to be coming out of a pandemic, hopefully, in a kind of very damaged way. And if there's one thing that everybody wants at the moment, it's a bit of clarity and a bit of certainty. And unfortunately, as a consequence of Brexit, there are still those unanswered questions. So despite having a deal, there's still work to do. And I think that's kind of the take-home message I've had from the panel's discussion tonight.
Okay, so thank you, everybody on the panel. Thank you for answering with great clarity why Brexit is relevant to the NHS. I'd like to say a big thank you to everybody out there who's joined us this evening to watch this panel discussion. And I'd also like on this occasion to say a special thank you to one of the people you never see on screen, but has been instrumental in organising these events. Grace Ogden, who's one of our college team, is moving on to opportunities and pastures new in her professional life. So we wish her very well with that. And a big thank you to her for everything she's done organising these events. We've been focusing for the last hour on Brexit, but I know each and every one of you out there has been focusing hugely over the last few months, and especially in the last few weeks, on the vaccination programme for COVID. So on behalf of everybody at the college, thank you to all our frontline colleagues, clinical, non-clinical, and the administration, and the volunteers that are supporting them in this huge effort to get the COVID vaccination rolled out there. Thank you to everybody for explaining the role of the college around Brexit, and I look forward to joining you for the next of these events in the future. Take good care, enjoy the rest of your evening, and thank you very much indeed. Good night.